800-859-0957, 859-0WJR. If you have a question for Dr. Michael Gray, he is in studio. He is the renowned cosmetic surgeon of the Michigan Cosmetic Surgery Center and Skin Deep Spa. We have him here live for this special edition of The Big Story. Kathy has a question from Livonia. She's been waiting patiently. Kathy, what's your question for Dr. Gray?
Hi. I had always heard that if you have liposuction, for instance, let's say on your thighs or anywhere on your body, that you will then store more fat than you used to in other areas because those fat cells are gone. Is that a myth or is that true?
That's not true. Once you reduce fat in a particular area, that area is called the problem. Problems you cannot fix. That's why I have my job. I fix these problems. So I wouldn't pretend to fix an air conditioning unit. So people, because what I do is elective, they go out and they try to diet and exercise. They can't do it. You will not, when you gain weight in a specific spot after you, quote, treat the problem. You gain weight everywhere. What happens in women, if you do gain weight, you don't gain weight because you did lipo. You gain weight because you're eating more calories and burning less. So what happens in women, it goes on the outside of their body, and men, it's hidden underneath the muscle. So men's muscles protrude forward, and most men eventually become a tub. And you can't lipo that. That's pure starvation. But what I just said earlier is if you starve yourself, it comes out of your face first in men, face and breast. So it compounds the problem. So basically, I'm not saying people not to exercise, not to diet. You always have to be healthy and do the right thing. But you won't gain weight in another spot because you reduced one spot. You gain weight everywhere when you gain weight.
Okay. But your fat cells are gone.
Those are gone. So if you have 10 apples and I take 4 away, you have 6 left to grow. And they grow like balloons. You don't get more apples. They inflate like balloons. The fat cells inflate. So eventually, if you eat real poorly, eventually you'll have to use the stores of your body to hold the fat. And that's the fat cell.
Okay.
Thank you, Kathy. Dr. Gray, when a person comes in to see you about a particular procedure, there's a consultation process, isn't it?
Absolutely.
And so it's,
sometimes very lengthy.
And I want people to know that. It's not just, okay, here, Dr. Gray, I want this procedure done, and here's the money, and let's get it done.
I don't do that. People get pissed at me because they just want to do the procedure, and I'm not going to let them. Even if a doctor comes into my office, as far as I'm concerned, you know nothing. I'm going to go over it with you because until I tell you, you don't know it. So I have to go over everything with you. What are your options? Different ways, different options you have to proceed with it. What do you want to do? I have to get into the person's mind to figure out exactly what they don't like. Because when they tell me and they point to a body, I don't like this, it doesn't really tell me exactly what they're talking about. I have to explain to them, is it the skin that you don't like? Is it the volume you don't like? Is it the muscle underneath you don't like? What is it there? And then there's different ways to treat it. And then I have to figure out what they want.
What if a woman comes in and she wants breast enlargement and she wants the biggest breast she can find that's like 100 times bigger than she is?
Not going to happen. Skin doesn't stretch. Skin will grow. A stretch mark is not because skin stretches. It's because skin tears and rips. So there's lasers, again, that treat that. But there's a limited amount of room. Skin is actually leather, okay? But we don't make shoes out of humans, but we make shoes out of every other animal. And so people don't really know that skin is leather. So if you have a leather pocketbook and you overstuff it, it's tight and it's hard and it's distorted. So you can grow skin. Any pressure upon skin will cause it to grow. Pulling it, gravity, weight gain, babies, implants. So slowly over time, you can provide more cells. These cells multiply, and then in the future, she can go bigger. If she has room, she can do it. This is elective surgery. People can elect to do what they want. But, when they come to me, it will be done safely, it will be done correctly, and it's not me to tell them what size they want to be. I don't want my name associated with abnormal surgeries. So, that doesn't help me out, and it definitely doesn't help the patient out because they may not fully understand what they're really asking me. So what I do is I show them the largest they have room to do. I have set the upper limit.
Okay.
That's the upper limit. That's what will give them room for the balloon, and everything will be soft and look natural. Anything larger than that is abnormal.
800-859-0WJR, 800-859-0957. It's 7:20, and you're listening to a special edition of The Big Story. Coming up, more calls for Dr. Michael Gray of the Michigan Cosmetic Surgery Center and Skin Deep Spa here in studio. And if you like more information on Dr. Gray, you can visit anewyou.com. We'll be right back with more of the big story here on News Talk 760 WJR. And welcome back. Tonight, we have Dr. Michael Gray of the Michigan Cosmetic Surgery Center and Skin Deep Spa in studio to take your questions about cosmetic surgery or minimally invasive procedures that he performs. And the number to get a question in to Dr. Gray, 800-859-0WJR, 800-859-0957. Dr. Gray, I want to ask you about cankles. We've been hearing a lot about this, and the cankles or chubby ankles, I guess. Are you doing surgery for that?
Yes, it's very common.
Really?
Yeah. Women, they wear boots, and they can't wear the shoes that they want to wear because their ankles are large, and they want them reduced, and very common. Do that all the time.
And I would think that some, like you said, who wear boots, who zip up the boots and they can't zip them because the ankle is too big, but they love this particular boot.
Right, yeah. Or it's tight on one part of the leg and loose on another. It's a problem. So for fashion, for appearances, we can reduce the volume of fat there. Of course, you go no flatter than the muscle. So when women lift weights, it's a big mistake. I go to the gym to get bigger.
Okay.
Women go to the gym to get small. It does not compute. Not going to happen.
What's involved in that particular procedure, Dr. Gray?
Well, basically, we could do ultrasonic and combined with laser lipo, smart lipo. Mm-hmm. We can do one and not the other. Basically, through small little punctures where the ankle ends and the calf begins, and down by the foot, we can reduce the volume of fat in the back of the leg. And you can tell how much fat you have by just grabbing it, because skin's very thin. It's like paper. So you grab the back. If you pinch it, that's fat, because the muscles are deep, and you can't really grab the muscles.
Is there a particular age group that you see that comes in to get this type of procedure done?
It's all genetically related. Typically, people deal with it in the beginning of their life, and then slowly, as it become more fashionable, I guess in the 18 years of age and on, it's a problem. People study their problems for many years and deal with it, and then they try to hide it, and they try to fix it on their own, and they end up they can't do anything about it, and they eventually trickle into the office. Not uncommon for me to hear patients say, I've been dealing with this for 20 years, and
really?
Or I've been going to the gym 6 days a week for 5 years. And I go, wow, is that how you want to enjoy the rest of your life? Doing that, or not enjoying your life by living with something that you don't have to live with? People say they're shallow, but it's not that. This is medicine. What I do is medicine. It's part of medicine. It's elective medicine, and it makes people happier. It helps them. It also, when people do lipo, their metabolic rate increases. Mark, I saw on the screen, had a question. Mm-hmm. Will lipo jumpstart weight loss? Absolutely. By doing liposuction, it increases your metabolic rate, especially as you're healing, and you're just burning calories.
Let's go to the phone lines, 800-859-0WJR, 800-859-0957. So we'll put Mark on, and Mark, you have a question for the doctor.
Yeah, and you pretty much, I think, answered it. I just want to make sure I understand. So if you're looking at 35 to 40 pounds to lose, it's not better to wait till after you lose it before you, so to speak, finish it up, or that it actually can be beneficial doing it first?
Well, here's the thing. This is the way you have to look at it. If I go to a fair and there's a balloon there that's big, and I throw my dart at the big balloon, I'm more likely to hit it than a little balloon, okay? These fat cells are big balloons and little balloons. As you start reducing your volume, you're making my job a little bit harder. I don't necessarily have to remove the cell, but if I can destroy the cell, it's done with forever, and the fat will disappear. So what it is, you don't want to have a lot of luggage lying around that can be filled later at a future date. Your weight loss, diets don't work, okay? You will not be successful with dieting unless you are able to maintain what you do and even change with genetics over time, because as you diet, your body will respond with a countermeasure and will require less calories to survive. Your body will always be an active storage for the future. So we know that's where surgical weight loss comes in to play. That's successful because we're surgically providing a solution. Well, lipo also provides a solution by eliminating the storage depot. So what happens is I don't recommend people diet before they see me. Let me do what I can do. Your metabolic rate will increase, and then you're going to drop very quickly. There's different stages of dieting. You have the plateau phases and the down phase. The plateau is where you're doing everything right, but nothing drops. And what happens is the plateau phases are shortened after lipo, and the drops are steep.
I see. So, okay, so there would be a noticeable difference after I was done with that procedure, even before exercise, then you're saying?
Absolutely. I just took 10 liters out of a woman today before I came on the show. She's doing great. Wonderful. Excellent. We do this all the time. And, that would, 1 liter of water weighs maybe 2.2 pounds. So it's 5 2-liter bottles of pop. Maybe that weighs, 15 pounds. But I know when she comes back to see me, she's probably going to be losing 20 pounds. Next time I see her, it'll be 30 pounds, provided you do the right things. You still have to do the right things. You have to watch what you eat. You still have to exercise. But what happens is it does jumpstart you. The metabolic rate increases, especially as you're healing. You're burning many more calories right after lipo.
All right, Mark, thank you for your call.